Today will be a working day for you, Kelly.
Yes, it will.
Okay, and how strange does that feel? You know, when some days some nurses will work and some won't.
It is hard because obviously we would want to be on the picket line, but obviously we have to provide emergency care and life-threatening care to keep our patients safe. So there are certain areas that are derogated. So if you're derogated, you don't strike, you actually go to work. So most wards are derogated so that there are numbers of nurses on the wards to keep patients safe and provide the care they need.
Yeah.
So just tell us a little bit about why you chose to be a nurse and how hard nurses are finding it to fulfil that vocation and do that whilst bearing in mind we're speaking to the government later in the programme. You have their ear. So tell us exactly what your grievance is.
So I came into nursing over 25 years ago, and I became a nurse because I wanted to be able to look after somebody in their hour of need, if you like. I wanted to be able to brush their hair, hold their hands, give them the care that they need when they're unable to do that. And at the moment, we're not able to do that. There aren't enough nurses. There's 46,000 nursing vacancies that we can't fill, because how do we attract new talent into the job when they're having to get... I was speaking to a young nurse who's just qualified, who was over £85,000 worth of debt in student loans because she'd had to qualify up to master's level, and then she's coming into a job and earning £26,000 a year. That's before tax, national insurance, pensions taken out. They're coming in and working in conditions that are horrendous at the moment. So how do we attract new talent into the profession? We can't. A lot of people have left because of COVID. You know, the government is saying, oh, the care homes have got no staff. They sacked the majority of those staff because they refused to get the vaccine. So, and they've gone and got jobs in supermarkets where they're getting paid more money to work in a supermarket than to work in a care home.
Basically, you've got politicians, Kelly, who have never had a real job in their lives outside that political ring. But I'll tell you this, right? And I've spent a lot of time in hospital, unfortunately, about 3 weeks this year in hospitals. Let's talk about the A word, agency staff, right? So we're talking about not being able to attract people to the profession. No difficulty in attracting agency staff. Nothing against agency staff, you know, but they're paid at a higher rate. That's not the issue, because politicians and the authorities, they're saving on pensions, they're saving on holidays, they're saving on staff benefits, sick pay, all sorts of things by hiring agency staff. Therefore, they're cheaper and they're probably needed. What is the relationship between full-time staff and agency staff? What's your view on agency staff?
To be honest, we couldn't function without agency staff, and a lot of nurses are having to do agency to top their wages up. A lot of nurses are using food banks. I've got a relationship with the local food bank, and the amount of nurses that are having to use that on a weekly basis to feed their families is disgusting, to be honest. I mean, nurses are there to look after other people. Who's looking after the nurses at the moment? Nobody. It doesn't sit right with me, us striking. I never thought as a nurse I would be on a picket line. But the government need to take ownership and come to the table and talk about pay. You know, this government has raped the NHS for the last 12 years, and that's why we're in the situation that we're in.
It's interesting, you know, I was reading that Pat Cullen, the General Secretary of the Royal College of Nursing, saying that yesterday she was at her lowest ebb, that she was really just despairing that they were having to take this action. She said it was heartbreaking that nurses were going on strike. And the general public are on nurses' side. That's what the polling shows. The general public support what nurses are doing. And yet, if you can, put yourself in the shoes of the Chancellor who's inherited this terrible financial situation post-war, you know, everything that's happening in Ukraine, trying to balance the books. We've got taxes at the highest they've been in 70 years. He says that inflation is the single biggest enemy of those people who are going out on industrial action, that he needs to halve inflation by the end of the year. Can you see that he has an incredibly difficult job trying to answer all of the demands of the unions without upsetting taxpayers, without making inflation worse?
I do understand he's got a difficult job, but he didn't have a difficult job giving himself a pay rise and giving the barristers what they asked for. And I just think he needs to sit down and think about what the general public who are having to not have heating on days like today because they can't afford to turn it on. The last pay rise that they gave me enabled me to buy 1 loaf of bread a week extra for my family. That's what it equated to in real terms. And I just think they need to come and walk a day in our shoes, gladly come down to an A&E and spend a 12-hour shift without a break, without going to the toilet for 6 hours, and then come and see what they're having to do and how you're having to nurse patients on corridors and in ambulances. Would they like their relative to have to wait 36 hours on a trolley? I'm sure they wouldn't. Most of them have private healthcare, which I feel this government, this is what they want to do. They want to destroy the NHS and make it private. And most of us won't be able to afford private healthcare.
Do you have an objection, though, to people who use private healthcare? But surely the more people that use private healthcare, the more that are taking a burden off you and your colleagues' shoulders.
I don't, but then you've got to look at there'll be a massive gap where if you're rich, you get the health care that you need, you can get the treatment that you need, and if you're poor, you won't. And do we really want that when everybody should be entitled to health care? OK, so in conclusion, Kelly, this is not just about money. To say this is about money, which is part of it, because you're doing more work, you're doing far more work and having more responsibility. Of course you want more money and to be rewarded for that. But this is about recruitment, this is about nurturing people into the profession, and this is about politicians actually realising what's required to fulfil your job then. Definitely. I mean, if we could fill those vacancies, we could open more beds and then we could have more wards in the hospital. At the moment, there isn't enough nurses to run the wards that we've got, you know, and it's short-sighted to think, oh, we just carry on, and then eventually nurses with lots of experience are going to retire, and that vacancy is going to get bigger and bigger and bigger until there are no nurses left.
Well, Kelly Hopkins, you put your case so passionately. We have huge admiration for you. Intensive care nurses, absolutely incredible. All nurses, but I have to say, having my father once being in intensive care, so much respect for ICU nurses. Thank you for telling us
Kelly,
your story.
Are you starting or ending your day now? Are you beginning or ending your day? Beginning.
Oh.
Well, I hope
a good
the shift goes well, and
Thank you.
I know it'll be a long day for you, and we can sit here and say you're doing a real job compared to the likes of us, so respect to you. Thank you very much indeed.